You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Thanks for tuning in to another episode of the Expert Guide to Parenthood podcast. We're your hosts, Christy Hopwood
and Freya Owen.
And we love talking all things pregnancy, birth, baby and parenting. And today we're going to be talking about the pregnancy side of things, and we're going to be talking about vaccines in pregnancy.
We are joined today by our obstetrician and gynaecologist expert, Dr. Peter Jurcevic. Dr. Peter Jurcevic works in both public and private practice, and he has more than 30 years of experience delivering babies. We are so lucky to have him with us today and as part of the Parents You've Got This expert team. Thank you very much, Pete, for joining us.
My pleasure.
So, Pete, why is it important that pregnant women consider being vaccinated?
The world that we live in is full of a large number of significant viruses, bacteria, pathogens, for which we're going to birth a baby into. And babies particularly, as small and, dare I say, vulnerable individuals, can be, or very likely will be, exposed to these pathogens. And these are quite significant things which can lead to quite significant illnesses in children, and even in extreme cases lead to mortality. And the thought that we would potentially lose a child when potentially we have ways of preventing that would be a great tragedy. And so that is where vaccines step in to help to keep babies safe.
So Pete, how do vaccines work? What is the percentage of the vaccine that goes from the mother to the baby?
Okay, so there's two components to the question, and we'll focus first of all on how a vaccine works. So in essence, as a mother incubating a baby in your uterus with a placenta sort of attaching between the mother and the baby, the vaccine is administered and then the mother will mount an immune response. So essentially it's a foreign body, for argument's sake, and so your immune system will create antibodies. Now it's those antibodies, those very special important antibodies, which then cross the placenta and go to the baby. And it's those antibodies which are then circulating in the baby when the baby's born. So when the baby's born and perchance gets exposed to a specific pathogen, virus or bacteria, it is hoped that that antibody will then be able to attack that pathogen and stop it from taking a foothold in the child and making the child ill. With respect to the question of how much of the vaccine goes to the baby, it's difficult to answer, and I know that this has been looked at in the literature, and the pharmacokinetics and dynamics of a placenta and how much of the actual vaccine itself goes into the baby. No one's sure of the exact amount. But I guess a kind of an argument we could use is that in everything we do as a mother when you're pregnant, from smelling to drinking to eating to breathing air, going to the petrol station, filling up your petrol, there's always going to be inhalation or ingestion of some form of chemical in your food and air we breathe in, etc. And of course we don't know how much of those chemicals cross the placenta, exactly what concentration amount. We also know exactly what effect that has on the baby. We make assumptions that they have no effect because most babies are born well. And again, same sort of thing when it comes to the vaccine. Small amounts probably do go through to the baby and the baby gets exposed. But in essence, it's actually the antibody that the mother's produced crossing to the baby, which is the key element of why we vaccinate.
Pete, are there some vaccines that are recommended in pregnancy and others that are not?
Sure. So the current absolute recommendations in pregnancy, and again, this is a recommendation, it's then your choice to whether you have them or not, is a flu vaccine appropriate for the season and at the time of the year when the flu vaccine becomes available. And that can mean any trimester. So you can be just pregnant, first trimester, all the way through to the second and even third and late stages of the pregnancy before about to deliver. Flu vaccine, highly recommended, particularly because influenza, the flu, can make you, when you're pregnant and your immune system is naturally suppressed, quite ill. And I have seen a number of women in ICU over the years, and including in my job as recently as 2 weeks ago, where a patient was on the respiratory ward at the hospital adjoining where I work, really quite critically ill from an illness that probably wouldn't have affected her as much had she not been pregnant. And of course, some of that antibody will then pass to the baby, providing it with some early protection from influenza until a few months old, when it would be recommended to have a vaccine as well. After the 20th week of a pregnancy, and this is irrespective of whether you had one only as recently as, say, 2 years ago with your last child, if you're having a second baby, we recommend that you have a whooping cough booster. Now in Australia, the whooping cough booster comes as a combined so diphtheria, tetanus, pertussis, and it's the pertussis, Bordetella pertussis, which is the whooping cough. That component of that vaccine will then be administered after 20 weeks, allowing the mother to make an immune response, again, for those antibodies to cross to the baby. And whilst we recommend that partners or close caregivers to that child have one every 10 years, and in actual fact everyone should have one every 10 years for their own personal health, and you'll therefore have some antibody from that vaccine you got 2 years ago, what we're doing is giving you an immune boost. So you'll have more antibody so that more can pass to the baby, so the baby will be better protected from whooping cough. And as of last year, and we did a fantastic presentation on this, which I was really enthusiastic to do, is the new RSV vaccine. And the RSV vaccine is to protect against bronchiolitis. Now, in Australia, it would be virtually guaranteed that a child in the first few years of life will get RSV. It's almost a given. And for a parent bringing a child home to another child, and particularly if they go to care school, and if you work in certain industries where you get exposures, it's a really high prevalence. And I know for a fact last year through the Children's Hospital, I was quoted as 25% of their admissions into the emergency department were for bronchiolitis.
Wow.
Okay, and in a young child under the age of 1, the severity of bronchiolitis can be really, really quite significant, and you can lead to mortality. So the RSV vaccine now available is recommended after about 28 weeks in the pregnancy, and ideally before 36 weeks, again, to develop an immune response to pass to the baby, so the baby's protected in those first few months of life until it can be appropriately vaccinated if necessary to other appropriate sort of pathogens.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
And so how long do they last for, Pete?
So in terms of the actual length of duration in your body, there will be real variance between the different vaccines. For the most part, they'll be short-lived because essentially you're giving a non-attenuated virus or a version of the genetics of the virus or the pathogen that you're actually wanting to create the antibody to. And so by simple passage of that out of your body, by the immune effects of your own body attacking that, it would eventually be sort of, I guess for one expression, sort of decaying in your body. So not long is the answer, but there'll be some variance.
Are there any side effects of any of these vaccines, Pete?
Sure. For the majority of people, you won't notice much of anything, and occasionally in the first 24 hours or so, you might notice a slight fever, and in some respects, you might just feel off. And the argument is that what's happening is your body's realise that there is a pathogen there and it's developing an antibody response, and that immune response creates sensations in your body which you can argue are positive. Of course, at the injection site, you can occasionally get a localised sort of induration or swelling. It's very, very rare to get a vaccine allergic reaction, and certainly there's always a questionnaire that's asked and filled in prior to getting a vaccine, particularly with regards to any potential allergy exposures and so on you might have had in the past. But for all intensive purposes, they are really safe and very rarely cause any significant health consequences.
In regards to giving the vaccine, are they done on a schedule or can you have them all together?
So traditionally I've given you the timelines for when we recommend them, so flu anytime, after 20 weeks for the whooping cough, and then after 28 for the RSV. But you can actually have them simultaneously. One of the comments or arguments that I pose to when I look after is that it's convenient to do that, but by the association of the large immune reaction you might get, you might not be feeling great for the next day or two afterwards, and so you may wish to maybe stagger them if it's convenient. But because time is precious and getting to see the GP or the pharmacist sometimes can be challenging, if it's easy just to get them all in one hit, you can safely do that. Yep.
Pete, why are there some vaccines that are given to the mother in pregnancy and then there are others that we wait for the baby to arrive to give them the vaccine?
Sure. I guess the best way to answer the question is that the immunologists, the infectious disease experts, the people who kind of understand the way that the vaccines work and the timing, scheduling, have felt that this current protocol is the best for women in pregnancy. And then once the baby is born, then as per the current schedule we have, for example, hepatitis at birth and then the 2, 4 and 6 months of age, where they'll get the diphtheria, tetanus, pertussis, plus they'll get meningococcal, plus they'll get polio, plus they'll get all the other ones, rotavirus, etc. And there's a very expansive schedule. And I remind all parents that these are always a choice for you to make on behalf of your child, but certainly I would encourage them, because if you see a child, for example, that has crippling rotavirus gastro as a young baby, it's really significant. A baby that can be on respiratory support for severe RSV or whooping cough, a baby that is coughing so violently from whooping cough that it's actually almost coughing its brain to mush. This is a real thing. With a preventable, useful vaccine as a tool, I would really implore people to really consider very carefully going down the pathway of doing it.
And so, Pete, how do they know these vaccines are safe?
They know they're safe because vaccines, like any medication in Australia, have to be studied extensively and then approved by the TGA. And again, it comes back to a comment I made earlier about this notion of we smell, inhale, ingest, swallow, drink, eat, absorb through our skin chemicals on a daily basis through our food, our cosmetics, everything. And the question is always going to be in relation to all of those really intricate and interesting chemicals, what is the potential for that to cause any effect on our growing fetus? And so we don't know the answer exactly, we make assumptions. Now, assumptions is one thing, but science and statistics and actual data research is another, and with vaccines that's what we have. So they have to be ticked off as being safe, so the evidence is there.
Pete, are there any vaccines that are recommended in the post-pregnancy, postnatal period?
Sure. So I think if you, as a pregnant woman, have missed your flu vaccine, you should get that. And then obviously, per chance, if you didn't get any of the other vaccines, and I'm focusing more so on the whooping cough booster if it's been over 10 years, the RSV vaccine is very specifically geared towards you having it on behalf of the baby. And some of these vaccines, like RSV, the COVID vaccine, etc., are now currently more sort of age or health specific. So, for example, I get asked a lot, do I need a COVID vaccine? And whilst you can offer a COVID vaccine to a woman in pregnancy, the actual recommendation for its use is someone who's sort of 50, 55 or over with a significant morbidity, or over 70, 75 years of age. Okay, so if someone's 30 to 40 years of age pregnant with no other particular health concerns, it would be really optional and not absolutely necessary.
Well, Pete, thank you so much for coming on the Expert Guide to Parenthood podcast. We always love having you on with your time and expertise. Thank you.
My pleasure.
You've been listening to the Expert Guide to Parenthood podcast. We've got a whole host of other episodes with Dr. Peter Jurcevic. Make sure you check those out. Also, check out his socials for some evidence-based information there about pregnancy, birth and postpartum.
A huge thanks to Mustela for sponsoring this episode. Did you know that Mustela is not only for babies and children? Mustela also has a range of maternity products, like the 100% certified organic Stretch Marks oil, Stretch Marks cream, and the certified organic lanolin-free nipple balm, made up of 100% natural ingredients and dermatologist tested. Mustela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.